Good, and I'll send you a link to it
Okay.
when we're done.
Okay. Sounds good. Thanks.
Yeah, I'll drop it on like an internal, probably YouTube channel that we have and send you
Okay.
that. So,
Okay.
um, okay, so let me share my screen and you guys tell me if you see a document.
Yes.
Okay,
Yes.
so I usually start here. Let me back up a step. Everything that I'm going to show you here is you either got it from us in the past, which I know the past was a long time ago. I think we onboarded you in November or got you added, got your enrollment, and then the person that was responsible for reaching out to you thereafter and kind of doing this at that time left our company at exactly the wrong time. Like from that
Okay.
perspective, it just was one of those things that it just slipped through the cracks, quite honestly. So I profusely apologize for it. But anyway, so some of this stuff you probably received back then. Um, and almost all of what you received back then has probably been updated and
Okay.
improved upon since then. So I'm going to show you some things during this, but also when I get to the part where we talk about the provider portal that you probably, I assume that you used to register that sample last week, there is a tab in that portal called resources
Okay.
that has all of this stuff that we're going to go over here over, over the next little bit of time, and then some other things as well that I probably won't spend time on because it truly is just resources if you need them, but I'll at least point them out what they are. So anything that you received from us in the past in terms of instructions, checklists, etc., I would just disregard. And
Okay.
let's start with what is current. And again, it's all going to be there in that um, on that resources page of the provider portal that we'll get into in a minute. So um, at the end of the day, what we are hoping to get from, or what you, for you guys to act as is essentially a conduit, being a conduit between us and the patient. If at all possible, we love when the patient takes on, I call it the burden, but it's not really a burden. When they take on the responsibility of getting us the most important part, there's two critical things that we need to get. One is obviously their sample, but two is their information. And so we have various ways that that exist for us to get that patient information about themselves personally, their demographic information, their insurance information, and then what's going on with them in terms of why are they here to submit a sample for testing. They're kind of outlined at the top of this checklist. I call this a checklist, but it's really not. It's like a reference sheet. Um, One is the patient registration portal, which I'm going to show you in a second. Another is that provider portal, which I think you may be familiar with now. And the third is kind of the least common denominator. I call it if the internet breaks option, which is a paper requisition form. Here's what it looks like. It's awful. It's teeny tiny writing and it's no fun to do. But again, if all else fails and we can't get the information electronically, you can pull this from the resources tab of your provider portal, print it out, hand it to a patient with a clipboard, and let them go at it. Hopefully, we don't have to do that often, but should be pretty self-explanatory. They just need to fill out every section and turn it back in. But what I wanted to spend our time on mostly today is how to use the patient portal and how to use the provider portal for a few different things that it's there for your use. Um, so as far as the patient portal goes, you guys probably received something a while back that looks similar to this. Does this look somewhat familiar?
A little bit.
And if the answer is no, that's perfectly fine.
Yeah, I don't remember seeing it.
Okay. Usually in the like kind of welcome email that we send when you enroll, when we receive your enrollment, this will be sent as an attachment. And the look and feel of it has changed a little bit since the time that if you received it, it's changed a little bit. What it is it's exactly what it says. It's a set of instructions for how to use our patient portal. The things I really want to point out about it though is the patient or the portal that your patients will use are they access those through a location specific URL or website that's right here. It includes an access code that's specific to you guys. So this link that's in here, if you guys choose to do so, you can drop that on your website or social media or wherever, so that if you want to give patients the option to register themselves in our system before they ever get to the pharmacy, they can do so. For walk-ins,
Normally do that.
okay.
So I'll just have to check the link and make sure we have the right link on there.
If you had one, like, so the link itself has changed. However, if you did put one up based on what we sent you 3, 4, 6 months ago, whatever it was, that old site will redirect to this one. So you don't necessarily have to change anything. Probably the thing to check is just to click that link that you have up there and make sure that it goes to a site that has a look and feel like this with these colors and some of these screenshots. For folks,
sign paperwork with that on, Scott and Charlotte, that was in
okay.
this folder. It looks like what you have on the screen with that link.
Okay,
Okay.
but I assume the screenshots that are on there, the number of them has changed and the information that's below it, the kind of high level
Correct.
instructions have probably changed. So
Yeah, that's not
honestly,
exactly the same.
honestly, just get rid of that one.
Okay.
And pull this one from your resources page of the provider portal when we get to that. So that's what folks can use ahead of time, is that link. So post it wherever. For walk-ins, all they need to do is take their smartphone and scan this QR code, and it's going to take them to this link. So that, and again, by having this access code already embedded, that tells us who we're going to share their information with, of course, who we're going to pay that $20 per sample collection fee to, and who is going to be listed as the ordering provider or pharmacist on that particular patient's sample. The QR code, one of the things I'll show you in the resources tab of the provider portal is there's a JPEG image of this QR code as well. So some folks will drop that on their website or social media. I've seen it on a lot of Facebook posts, just telling folks to go ahead and scan that in addition to giving them the link. So anyway, we just want to have easy ways for folks to access this in whatever way you choose to share it. But what I see a lot of pharmacies do is they will take a copy of this, they might laminate it, they'll post it somewhere and tell patients, hey, if you're here to get a test, scan this QR code. There are some brief instructions here, but I think they will find that the patient portal is pretty intuitive. So let me just walk you through how that works. So when they scan this for the first time, they're going to be taken to a create an account page, where they're just going to be asked for first and last name, date of birth, gender, and an email address. Because those are the first 4 of those anyway, first and last name, date of birth, and gender have to be submitted with every sample. So we just go ahead and ask them for that up front. They're then going to be taken to what's called a dashboard page. And then there's some other stuff here. This is what it looks like on a mobile device. I'm going to show you so you can see how to use it. I'm going to show you what it looks like on a desktop here in a second. The only thing worth noting is on a mobile device, a phone or a tablet, the menu items that they're going to work their way through are on the bottom, and on the desktop site, they're going to be on the left here. So this is the exact same site. Can you still see my screen?
Yes.
Yes.
Okay, good. So when they create that account, their default is going to take them to this dashboard page. The first time they come on here, it's going to be blank. As soon as they register a sample or multiple samples, the dashboard page is going to include these tiles that have basic information about any sample that they submitted. It'll have, we assign a what's called a requisition ID to it. That means nothing. It'll have the patient's name, because I'm going to show you that they can use the same login to register samples for themselves and their dependents. So it'll include different family member names. Of course, it'll include the name of the test that is being run. And then there'll be a little icon here with a link next to it showing the status of their sample. So as soon as they register it, register the sample, this would show something, I think it says in transit, because we're waiting for the sample on our end. As soon as we scan it into our lab, I think it changes to active. I can't remember the different statuses, but it'll go through various statuses until ultimately the test has been completed, the result has been approved by our lab director, and then we consider it to be complete. And this button, in this case, it says rejected because this was a dummy sample that I created, but it'll say complete, and they'll be able to click on it and pull up their results report that way. In addition, before I go too far, in addition to the result being accessible here in this patient portal, it will also be accessible for you guys in the provider portal that I'll show you in a second. And assuming that the patient gave us a real email address and or a cell phone number as part of their registration here, they will get an email and or a text with a link that they can click, put in their date of birth as a secondary identifier. Since we're sharing private health information, you have to have two forms of identification. One is that cell phone number or email address, two is their date of birth, and their report will, once they enter that date of birth, their report will come up on their device or computer. So they don't necessarily have to live in this patient app in order to get their result. They'll get pinged, letting them know when it's available, and they can pull it again right up there on whatever device it is that they're using. It comes as a PDF, so it can be printed, it can be forwarded to their doctor, whatever they need to do with it. Does that make sense?
Yes.
Okay, so that's the dashboard page. For again, first time they log on, it's going to be blank. Then they just need to work their way through the menu items here. One is my info, just what it sounds like. There are some fields that have asterisks that are required. First and last name, date of birth, and gender will already be filled in because they needed those to create their account. So all we'll ask them for here essentially is their address. We do ask for that cell phone number or phone number, assuming it's a mobile phone number, and to verify their email address here. Again, if they don't do it, that's okay, but that's how they're going to get communicated their results, if that's how they want. We give them the option to upload an image with their phone of their, like if you're using a phone or a tablet and you select choose file, it'll say, do you want to take a picture with your camera's phone? And you can do that. We like to have copies of or images of IDs. It's not required. It's helpful. One, it helps us verify, yes, this is the person's address. Sometimes when you have, folks from different countries, if the date of birth is February 3rd, they might put 3/2/2011 instead of 2/3 like we would. It's just helpful for us from that perspective. Also, if this person's name was Jonathan instead of John, that's probably what the claim would need to be filed under. So it's nice to have, but not something we're going to make them do. But I think it's worthwhile to encourage them to do so. So they can put that information in. If their intent is to have this billed to their health insurance, that's perfectly fine. All they need to have is obviously active health insurance, whether that's a private policy, Medicare or Medicaid. We're enrolled in all of them. And they have to either present with symptoms or suspected exposure to somebody who has tested positive for one of these things we're looking at, COVID, flu, or RSV. I'll get to that in a second, how they note that. But what they will need to do inside this patient portal, and this is outlined on the instructions, is they will need to fill in the name of their payer, of their insurance company, and at least their policy number or member ID. They don't absolutely have to give us their group number because obviously some policies don't have group numbers, and we don't necessarily need the name of these other fields filled out. Again, nice to have, but they will not be able to register their sample and have it billed to insurance if they don't fill out these two fields. So they need to do that. If at all possible, we absolutely want them to upload an image of the front and back of their health insurance card. So if they have that card on them, it's really, really helpful if you encourage them to upload an image of it. one, the front of the card helps us verify that the information they put in here is correct, but the back of the card has the contact information for the office of that insurance carrier that happens to manage this particular policy. So if we do have an issue with a claim and it's Blue Cross, who has a billion offices out there, we know which one to contact to talk about what it is that went wrong, so we can kind of hammer it out with them, and we don't have to go back to the patient, because our ability to reach patients is lacking at best. They're not going to know who a random number from a 513 area code is from, so they may not take the call. So if at all possible, we want to just handle claim resolution directly with the carrier, and that the back of the card gives us the info we need to do that. So they put in their information. Again, just those two fields are what we really need if they're looking to have this billed to insurance, and they save their changes to create their profile. All of this can be done before they ever walk in the pharmacy. So if they're going to access that link that you talked about putting on the website, they can do that. From this point forward, they need to be inside the pharmacy, or they need to have visited the pharmacy, because when they go to order their actual test, the very first thing it's going to ask them for is a specimen barcode. And so, as Charlotte, I'm sure you saw, the collection kits that we send have some small QR code labels that come with them. The version you have, since it was sent a few months ago, is you probably have a strip of matching QR code labels.
I believe we do, yeah.
Yeah, and so the reason for that is when folks use a paper requisition form that I talked about at the beginning, and this is less than probably 3%, and that's probably even an overstatement, of the samples we receive will come with a paper requisition form. If I go back to that real briefly, there is a spot on there to put a matching QR code label. So one of them is going to go on the collection tube, and the other, we were asking, goes on in the upper right-hand corner, so I can tie this piece of paper with that sample. We have plenty of other ways to do that. And what we found was that the matching QR code label thing was creating just enough confusion that it was becoming problematic, where people didn't realize they were matches. And so they were putting the same sticker on two different samples, and that creates, conflict. Not the end of the world, but you'll see in the future, as we send you more kits, that we've gone to just a single barcode label for each collection kit. But that collection, or that barcode, I should say, or QR code label, has a series of letters and numbers below it. It always starts with MH and then has some numbers after it. They can type that in. If you guys are using the provider portal, you can click on this field, and if you have a 2D barcode scanner, you can scan it in instead of typing it. But for the patient, it's going to be easiest for them to type it in. The client is going to list it'll say Vine Pharmacy. The collected by will be the patient's name, because this is meant to be a self-collect on the patient's part. We don't need anybody on your staff shoving Q-tips up anybody's nose. It's going to auto-populate the current date and time. Again, 99% of the time, the patient's going to register at the same time that they're swabbing themselves. So we auto-populate that. I told you before that we can use the same account to test samples from patients and their dependents. And so the next thing it asks them for is who this particular test, the one that's associated with this QR code or barcode number, who's it for? So if mom comes in with her daughter, she can say, this first one is for me. Leave that as is. Down here, it asks which test it is that they're interested in. We still do offer a COVID-only test. Again, 95% plus of the samples that come in as part of this program are this combined COVID, flu, and RSV, for that test. And that is something that was probably added after you initially enrolled in our program. I can't remember our exact launch date of this, but it was sometime in the later part of the fall. There's no difference in anything in terms of cost or what insurance is billed or anything like that for either of these tests. This combined one, it's simply more information. It's great to get a negative COVID test, but if you're still feeling lousy, it sure is nice to see, what else could it be, especially when you're talking about something like flu, where there are actionable steps that you and the patient's doctor can take to mitigate that kind of an infection. So most folks will ask for that. There still are a few that need, are traveling somewhere like China, and they may need to have a proof of a negative COVID test to get in. They can select that one. Again, the majority of folks are going to select the combined test. So if you click that, that's when the patient will be asked for a couple of yes/no questions. Do you suspect that you've been in close contact with somebody who's tested positive for flu or for COVID? So essentially, did one of your family members or coworkers or something like that, did they come up positive? Yes or no? And then it'll ask you if you have any symptoms. So again, in order to be eligible for coverage through health insurance, you either need to answer yes to one of these questions. You can answer yes to both of them. You can answer no to both of them. You either have to have a yes up here or I should say, but certainly or one of these symptoms. So if you check yes, no, and a symptom, and you down here hit create order, it's going to go through without any prompts, and it's going to bill to your health insurance. If you don't suspect exposure, let's say you're traveling, right, and you don't have health insurance or something, but in this case, if you don't suspect you've had exposure and you don't have any symptoms, and you say I don't have any, and you click this create order, you're going to be prompted to make a credit card payment. So we don't need you guys at the pharmacy facilitating any kind of financial transaction. So if indeed the patient doesn't have insurance or is doing this for some other reason, travel, return to work, get into a facility, whatever, and they're not eligible for health insurance coverage, they could click pay for testing, put their credit card information in, and we'll bill them. It's $99 for the test. If they made a mistake and this prompt comes up, there's a note here telling them what they need to do. Again, you either have to have had symptoms or close contact, so you can cancel out of that and say, you know what, I actually do have a sore throat, or I was exposed to somebody, and then hit create order, and this will go away. But you also have to have entered that health insurance information that I was talking about on the previous page. We need your carrier name and your member ID. This thing calls for a group number. I'm getting that removed from what we need, because there, of course, are policies that don't have group numbers. We also say that you need to upload an image of your health insurance card, but pro tip, it'll go through if you don't do that. But we just like to reiterate that here when we prompt for payment, if somebody is intending to have this billed to their health insurance. So they can cancel out, go back in and say, you know what, I do have symptoms. I've got a runny nose and I'm stuffed up. And they can click create order, and it'll go through and bill to their health insurance. Does all that make sense?
I have a question. If they don't have capability of uploading a picture of their insurance card, but they do have symptoms and stuff, can we, in our provider portal, access this order and add that information on?
Absolutely. So at the very least, what we would want them to do is enter something here.
Okay.
If they know the name of their carrier and they know their policy number, great, have them enter that. If they don't, but they have, maybe I don't know, maybe there's another way to get that. Maybe they have they can call somebody and get that information, or they don't have it at the time that they've created their profile here or whatever. They can type in ABC123 here and just get the process started. And then, yes, when you go into your provider portal, you can find their record and update that information or upload a copy of their card. Or you can just make a photocopy of it as well, if you're okay with that, and just fold that up and put it in the bag with the sample. And we'll type in the information on our end.
Okay.
So there's, like I said, there's kind of ways around and through some of the things we've set up as safeguards. Those are a couple of them. But again, our goal or our ask of you is just help us do everything that you and the patient can to get us that accurate information, right? Give us the information typed in here if at all possible. That's kind of the line of first defense. And then if we can get that image or photocopy of the front and back of their card, even better.
Right.
Okay. So once they've created that, then that sample will show up here on their dashboard. I'll walk you through how the sample collection works. I think that's probably, it shouldn't be too tough. I'll walk you through that in a minute, but at the end of the day, they've registered their sample. Then they've got their collection kit, they swab themselves, they label that sample, they give it back to you, and they're out of there. And then they're just waiting for this to update and or to get that text and email from us the following day with their result. So any other questions on the patient portal?
I don't have any. I don't know if April does.
The only thing I could think of with the results, obviously, when they put in their email and or their phone, they will get the results. Charlotte, is that something that we also get or we don't, like results of their tests?
Yeah, we can see it in the provider portal, I believe.
Okay. All right.
I can get to that in here in a second.
Okay.
And yeah,
Yep,
the
no
answer is
problem.
yes. All parties
Mhm.
involved have access
Okay.
to those results. And so that's actually a good segue. If you think of other questions having to do with the patient portal, just interrupt me and fire away when you think of them. Our goal or our hope is that more patients than not will use this because it just takes the burden off of you, number one. Number two, we are more likely to get accurate information from them than we are from anybody else. So asking them to do it themselves is best from all perspectives. But again, we understand that not everybody will be willing or able to use an app or a tool like this. And so we have this provider portal, which it sounds, Charlotte, like you've accessed before. It's just portal.mobilityhealthlab.com. If you need other folks to have login credentials, like I don't know offhand what email address we set it up under, if it's something that you're willing to, share the credentials with other people, great. If you have others that you would like to have their own login credentials, just email that to me and I'll have a link sent to them where they can set up their access to this portal.
No, we can share.
Okay, perfect. So anytime you go in, this is very similar to the patient portal. You're going to be taken to a dashboard page, but it's going to give you a live look at every sample that we currently have in the system. Obviously, this is a bunch of gobbledygook that I've, as we've made changes to this is an admin login, and I've got, SpongeBob is getting a sample tested here. This is obviously fake info, but it gives you a picture of what goes on. As soon as a test has been or a sample has been registered on the patient portal, or if you guys have done it here, it's going to show up in this active orders table on your dashboard. And it's going to show that status that I was talking about earlier, where it goes from in transit to logged, maybe to active. And ultimately, when it's completed, it's going to move from the active orders table over here to completed orders. And that's going to include a link. I'm not going to show you this one because this is Chris Rogers's private health info, but I'll show you one of mine in a second. It's got a link where you can click it and you can view a copy of a PDF of the report. So to answer your question from earlier, April, yes, you have access to it at all times. Okay. On the dashboard, we leave those completed orders displayed on here for 3 days, thinking that that's the most likely time period in which a patient might call you and say, "Man, I didn't get that email address," and maybe it's because they put in a bad email address, or it got lost in, the junk folder for whatever reason, or they didn't give us a cell phone number and they didn't get their report that way. They can always contact you and say, "Hey, do you have a copy of that?" And you can pull it up for them. I think what happens even more than that is somebody tests positive for something and they call you and they say, "Hey, I tested positive for flu. What do I do now?" And so you guys can pull up their report. It's a PDF, so you can share it with their doctor if you need a script. If you need a script written for Tamiflu or Paxlovid or whatever it might be. But at least you have the information and you can have a discussion with the patient about what those appropriate next steps are. These tests will drop off of this dashboard page after 3 days, just because we don't want you scrolling forever to find somebody's sample. However, over here on the left-hand menu is a tab called Lab Orders. That will have, whoops, I got logged out. That will have every sample you've sent us since the beginning of time. So they never go away. There's also a search box over here on the right where you can query for a patient. So if I put in my last name, it's going to bring me and my family up. And so here are all the samples that I have ever registered through this system since we implemented it back in March of 2021. So you'll always have access to that. And then if you click on, here's my most recent sample. If we click on that, actually, I don't even need to do that. Right here, sorry, bear with me. Right here, go away. Here's the most recent sample that was run for me, and here's how you can see the report. If you click view, it's gonna download, and then here's what a report looks like. So it's got my basic information at the top about, myself demographically. It's got some sample ID information. It's got when my sample was collected, when the lab received it, and ultimately when the result was reported out. Those are things that we have to include in our submissions to insurance. And also when we're doing COVID testing, we still have to report this information to the state. We kind of batch report that to each state overnight. But we do have to tell them those three things, so we include it on the report as well. And then below that, general info is just a pretty easy to read table of here are the 4 markers that we were looking for: COVID, flu A, flu B, RSV, and the individual results for each of those. So hopefully it's not too difficult for them to read. Down below is just a bunch of required information around, what the test, like the specifics of what test we ran. That's stuff that's required by the FDA. As far as next steps, it's always going to say, talk to your provider about, whatever your result might have been. We're not allowed to dispense advice. We are only allowed to report results. That's our role as the lab. So that's what a report looks like. And then as far as the other things that you can do with this provider portal, again, you can access all samples that have ever been submitted. You can access every patient record that's ever been submitted through yours. So if Sarah Adams here was one of your patients and her date of birth was incorrect or she moved, you can go in here on her behalf and click here and edit her record and update that info so that she doesn't have to create an entire new profile if something has changed and she, for whatever reason, isn't using the patient portal. So all that info never goes away. As far as for those patients that can't or won't use the patient portal to register their samples, there is a menu item here called New Order, and it's going to look really familiar. It's how if a patient comes in and you want to do this on their behalf, it starts with that same barcode that's on their collection kit. Again, it always starts with MH for Mobility Health. It's got some numbers after it. The client will be you. The collected by, I'm trying to get this changed to the word self, so you don't have to ever type anything into it. I'm not there yet. So just type the patient's name in there, or if it auto-populates to whoever the user is. So Charlotte, if it said your name on here, so be it. It's not worth worrying about because that doesn't get reported anywhere anyway. But if you want, you can put the patient's name in here. We don't currently, and I will get this changed shortly, we don't currently auto-populate the current date and time of the collection, of the sample collection, like we do in the patient portal. The reason for that is this was initially designed for, this is a much more robust system than kind of what we're looking at. And so we do a lot of testing at doctors' offices, urgent cares, long-term care facilities, and things like that, where sometimes doctors or nurses will pre-register samples in the system, and then they will go back in when the patient actually comes in for their appointment, and they'll kind of put in the collection date and time whenever that actually happens. I don't think that happens very often in the pharmacy setting. So we are going to, at some point here, probably within the next few days, change this where it will auto-populate, and you'll still be able to change it if you need to, but we'll kind of let the majority use that 80-20 rule that most times it's going to be the current date and time. But for the time being, you just can click on this little calendar icon. It will default to the current date and time. So if you just click somewhere in there, it'll put that in there, and there you go. Same thing as before, you can choose either this combined COVID, flu, and RSV test or a COVID only test. We default to the combined one because we think most people think that more information is better than less. Leave the specimen type alone, and then you can enter the patient's information. If it's a patient that's already been in, you can query them here. So again, using me as an example, if I type in my last name, there I am, and all my info that has been previously entered comes up. And if something's changed, obviously we can change it. You can choose their billing method. If they intend to have this billed to health insurance, choose that. And then you just pop open this little box here, and that's where you can put in the information we need. Again, what's critical is payer name and policy number. And it's great if we can get an uploaded image or a photocopy of the front and back of their insurance card. And then kind of keep scrolling down. Again, this was developed originally for doctors and nurses. There's a place to choose a provider from a drop-down list. So Charlotte, I know you're in there, but if there are other providers, other pharmacists that you have that we've set up in your portal based on your enrollment form, there will be a drop-down list that you can choose from here. It really doesn't matter from our perspective. It doesn't matter from insurance carriers' perspective either. As long as whoever's name is on here has an active NPI number, you're the ordering provider. You're not doing any kind of approval. You're basically just stipulating that the patient is giving us accurate information to the best of your knowledge. Another thing, I'd said that this was developed for docs and nurses. They are very used to, from a medical billing standpoint, dealing in the world or operating in the world of ICD-10 codes, which is insurance speak in this case for symptoms. I believe I was told this morning by the end of this week, so that means the end of next week, that we will be switching this to, instead of having you enter symptoms here, it will be a series of checkboxes like we use on the patient portal. But for now, if the patient has a symptom, if they have a cough, you click in this box and you start typing in cough, there it is, you select that. If they are vomiting, same thing. If they've been exposed, start typing in exposed, and here's a couple of options. One is suspected exposure to COVID. The other is to anything else, flu, for instance. So they think they've been exposed to COVID, so you click that. And if you notice, I clicked the wrong one by mistake. To get rid of it, you can arrow over the blue button associated with that, click it again, makes it go away. And then I can go back into exposure and choose the correct one. All we need is one blue button. We want all the ones that apply. We want to get the patient's complete and accurate information, again, because this is something that might be used by a doctor at some point for diagnosis. But from the standpoint of submitting a successful insurance claim, we need at least one blue button here, or one of those checkboxes marked that I talked about in the patient portal. And then you just create the order, excuse me, and that sample will show up on your dashboard. So you said that you had issues, Charlotte, when you used this the first time. You want to let me know what those were? I think you guys are on mute.
Yes. Okay. Sorry. So where it was the new order under the diagnosis codes, there was really no button to click submit. That create order. We couldn't find that create order. That was our biggest time.
This wasn't there?
We did this at the end of the day because we knew it wasn't going to go out that day anyway.
Yeah.
Because of the UPS issue, we didn't have a label to ship it. And so we were filling this out after we closed, and it took us about probably 50 minutes to fill this
Oh
out.
my gosh. Oh my
Because
gosh.
one of the things was that we couldn't, she had everything else completed, but we couldn't find a create order or some way to actually submit it. And so we weren't sure. And then she'd go back and the address didn't save and stuff. So
So the
that was,
button, what
oh,
the
yeah,
button just wasn't there, period? Or
I
did they
didn't see
click it and it
no.
didn't go through?
No, there was no button to click.
Oh my gosh, I've never heard, like, I don't even know how that's possible.
Yeah.
I would say
And I wasn't
either,
part of the whole beginning of it. I only came in at the end when she was frustrated and,
yeah.
you know, trying to upload the attachments and stuff. So I
Well,
don't.
I'm sorry about that. I've never heard of it. One thing that you're gonna have after this is my contact info. If that ever comes up again, call me or text me or
Okay.
whatever, and I will help you figure it out. I'm not great at a lot of things in life, but one thing I am really good at is responding. So if you call me and I'm busy, I'll shoot you a text right afterwards or call you right back as soon as I can. If you text me, even better, because I can, even if I'm, in a meeting or at a kid's soccer game or whatever, I can hit you back right away and let you know when
Right.
I can help you, or I can pass it off to somebody that is in a position to help you. I've never
Okay.
heard of that before. That is so strange to me. I have heard of people, you try to create the order and it doesn't go through, and that will, in just about all cases, be because one of these asterisk fields was not filled out.
Yes. And we
But
did
you
go
would
back
still
to the
have the
county
button.
about that.
You would still have the
Yeah.
button. That's what I don't
Okay.
understand that at all. So
Okay.
maybe the thing to do is have somebody, like, maybe it's just you, collect your own sample. Just go through the process on your own and submit the sample. Give us your health insurance information. It'll kind of get you a feel for what the interaction is like as a patient getting your results. Well, you're not going to get billed anything or anything like that. It goes down as a sample that we pay a collection fee for too. So that's not a bad thing either. But maybe seeing if that was just I gotta feel like that was a hiccup, or I don't know. I've done hundreds and hundreds of these, and I've processed probably thousands of samples over the past few years, and I've never heard of that one. So something was definitely glitchy. So maybe if you get a chance, try it again if you don't have a patient that comes in, do it with you or one of your employees and see if you can recreate it. And if that's the case, I will get this is all a kind of a homegrown system. So, it's our IT guy. I don't have to go out to some outside provider and put in a case with them and wait 3 days before they get back to us. I can go right to the person who wrote the code and we can figure
Okay.
out what's going on based on that session that's going on.
Okay.
So I apologize for that. Yeah, that's so strange. I can't even begin to describe how strange I think that is, but um,
Okay.
yeah. So anyway, see if it happens again, like I said, and then we'll cross that one when we get to it. This should be a 5-minute, not a 50-minute exercise.
Right. Right.
Um, okay. Anything else that came up? I think that's enough. I mean, that's a big one, but
The
anything
only
else
other thing that came up was the shipping of like how do we get it to UPS? And since we didn't have a account that we could
Yep.
have it billed to Mobility Health, we were kind of at a loss.
Yep, I get it. I'll get to that. Let me show you one last thing here.
Okay.
So the last thing on this thing is, in addition to all these tabs that we were talking about, there is one for resources. And so if you click on that, it's going to have stuff that we think you need. It's going to have the JPEG image, or in this case, PNG. It's a photo file of the QR code that links to your patient portal. It's got your version of those patient portal instructions that are current, not the ones that you have. It's got the paper requisition form. You can download that and print it if somebody ever has to use that. It's got the most up-to-date version of our nasal swab instructions, which I'm going to show you in just a second. And just some other basic stuff, including a couple of things here that are marketing pieces One is kind of patient facing. It's called the consumer one, and it talks a little bit about at kind of a higher, more basic level what this test is all about. It's kind of a nice to have, and we'll send you kind of glossy images of this as well now that we've done this. And then there's one that's called a professional piece as well. And what I see a lot of pharmacies or pharmacists doing with that is if there are doctors that you are kind of friendly with out there that you want to make aware that this is something that you offer. So if they're not in the business of collecting samples like this in their office, and they tend to send folks to an urgent care where the patient is going to, wait in line for an hour and pay $100 in copay for the privilege of walking through the door, letting them know that this is something that you offer and asking them to send patients your way. That's got a little more detailed information that's going to be more appropriate for a healthcare professional to look at as opposed to a typical consumer. So we give you those as well. We have a poster, we have a couple different versions of a poster available too. And I think we had emailed you about this, but I don't know for a fact that we did, to be perfectly honest with you. We have one that's like kind of for a window. It's kind of floppy thing that you can put on a window or a door or something like that. And then we have another that's more rigid that can either go on an easel, or I've seen some folks attach it to an end cap. Is that something that would be a fit for your pharmacy? And if so, does either one of those appeal to you more than the other? Because I'd like to send you one or one of each or whatever you want.
I don't know about the end cap, but what was the other one?
The other one's just a poster, just
Yeah,
a kind of
poster
roll
would
up
be
type.
better.
Okay, all right. I'll make sure that he sends you that.
We do
to get
have
that-
one small poster, probably 10 inches across by, I don't know, 18.
Oh, is that you already
Why?
have that one?
It's of a someone in a lab with a mask on with test tubes at the top.
Yep, that's it. That's
We
it.
do
So we
have
already-
that one.
So we already sent that. Okay. When
Yep.
you got that, this is going to lead into Charlotte, your other question. When you got that, was there anything else that you remember in that package? Specifically, were there UPS labels?
Yes, we did receive labels.
Okay, so something else that has changed since you originally enrolled is we used to have you guys print labels on our UPS account. And since then, UPS has allowed us to change that procedure and send pre-printed labels to you. So anytime you collect even one sample, did you get some UPS boxes as well from us?
I believe there are some in the side room, Charlotte. I don't see the labels or the UPS labels here, but I know when we opened them, I think Gina put them over in that room.
Yeah, yesterday I think we received like 2 or 3 boxes of UPS boxes. So
Okay.
I think
All
we're
right.
really set.
Yeah, unfortunately, the minimum that UPS will send is like 50, which is ludicrous, but it's what they do. So you're set. Like, go ahead and have a ball.
Set.
Merry Christmas. So yeah, you put the samples in one of those boxes, slap one of the labels on it. And then to answer your question, there is a protocol that we probably have to reset up. And I will, as soon as we're done with this, I'm going to talk to our logistics guy about it. There is what's called a UPS pickup placard that probably already has been created. He just needs to get that to you again. And it includes a QR code that anytime you have something to ship to us through UPS, you basically just scan that QR code and it puts in a request for a UPS driver to show up later that day. I don't know in your case, like specifically, and he will be able to look this up for you, like what the deadline is for them to come in. UPS has been really, really good about this, trying to get somebody in there, say within the last hour and a half that you're open each day, so that you've got as much time as possible to collect those samples and get them out the same day.
I think we have something that was in that packet the other day. It's just a piece of paper. It says UPS pickup point for lab specimens.
Yep.
On the left-hand side, scan to request a pickup. It has Monday through Friday with times on. Is that what you are referring
That's
to.
exactly it, but he's gonna
Okay.
have to, I'm gonna have, his name is Andrew. I'm gonna have him reach out to you because there's something that he has to do. Basically, this is so dumb how they do this, but this is what it is. They ask that that you hang that up somewhere in the pharmacy in an identifiable, like conspicuous place. So say you put
We
it,
did. We
okay,
did, and
they're,
I sent him pictures of it from my personal cell phone. I think what you're referring to, we did, because he said I have to have proof, April, that you hung it up.
yeah, it's so dumb. Okay, good. I'm preaching to the choir. So that's already been done. So he has
Yeah.
uploaded that to UPS. So
Okay.
So theoretically, what that means is you scan that QR code, UPS comes in, they're going to go look for that placard and hope that there's a box under that. That is so unrealistic, right? Maybe that works in a warehouse or something, but they're going to come to you and they're going to say, hey, I'm the UPS driver. I understand you have something for me. Can I have the package? Right. I mean, so the need for that, having it posted somewhere conspicuously is pretty minimal, but it is what it is. I'm glad you already went through it, but that's how that happens. Now, if we get into a situation where more days than not you have samples to send us, my hunch is this won't happen until the fall, but let's say that happens, we can convert that to a recurring daily pickup where there's no notification that needs to be sent. They will just kind of magically show up towards the end of the day every day. And as long as, again, more days than not, there's something for them to pick up, they'll keep doing it. If it goes a week or 3 weeks or something like that and there's nothing, then they'll ask that we go back to the manual scan the placard thing. So my hunch is for now, you're not going to get overwhelmed with sample requests. I hope you do. Maybe I hope you do. I don't know. That's kind of bad for everybody else. But if that day comes, we can convert you to that. And they're more than happy to do it, but they want it to be from their perspective, a successful trip in order to, more often than not, in order to make that commitment. But for now, that's what you do. You scan that QR code and they will come in. And if that becomes, if that's a challenge for whatever reason, we can initiate that for you on our end as well if you just reach out to us. But it works pretty well. We used to be with FedEx. We moved to UPS about 6-8 months ago. It's night and day. We've learned that UPS has something like 17,000 more trucks on the road than FedEx does, and so they're much more nimble and accommodating to kind of last minute things. And more than likely, right now, as we all sit here, there's a UPS truck, at least one, within 2 or 3 miles of us at all times. So does
Sounds
that answer the UPS question?
I think that does on my end, but Charlotte, does that answer it for you?
Yes. Yeah.
Okay.
That's fine.
Let me go through the last piece of this and then I'll let you go. We know, hopefully we know now how to register samples either in the patient or provider portal. We covered the UPS thing, hopefully. We have this set of nasal swab instructions. It too has probably been updated since the ones that you might be holding. So again, I'm happy to email this if you'd like, but in your provider portal, there is a set of these now of these instructions that you can refer to. Some pharmacies laminate a copy of this and post it. I think just as many, if not more, will make photocopies of it and hand it to a patient with their collection kit so that they can go out to the car or off to the side, or again, most importantly, not standing in front of you at the counter or the bench, taking up space in line and coughing all over everybody. It's kind of, baseball and apple pie at this point. It's pretty common knowledge, but just to make sure, there's a tube, there's a swab in a sterile package that's included. They're going to take the swab out of the tube, hold it on the stick end, not the Q-tip or swab end. We want them to swab both nostrils. So about 10 seconds in the right, take it out, use the same swab, 10 seconds on the left, kind of swirl it around in there to make sure you get a good representative sample. This is a nasal swab. It's not a brain swab or a throat swab or anything like that. So we tell little kids, put the swab in about as far as your finger will fit and 10 seconds is about how long it takes to sing happy birthday to yourself. So put it in about 3/4 of an inch, swirl it around, sing happy birthday, do the same thing on the other nostril. Take the cap off the tube, the collection tube, put the swab in there about 2 inches or so up the handle of the stick. There's a notch. You just bend it there. It'll break pretty easily, and that allows the cap to fit on the tube with the swab inside it. And then I'm going to make this a little bit bigger so you can see it. On the tube already will be a label with 2 lines. We want the patient or somebody on their behalf to write the patient's first and last name and date of birth on those 2 lines. The reason for that is if this sample, for whatever reason, gets separated from their electronic or paper record, I always know at easy glance, and so does an inspector, which we get inspections from CDC and FDA and CMS, which is Medicare. We get those. We have to be able to have easily identifiable proof that this is your sample and not mine. So have them write that on there. And then in addition to that swab and collection tube, each kit has that QR code label that we were using earlier to register the sample on the portal. Just peel off, in this case, you have those matching pairs, peel off one of them, stick it somewhere else on the tube. Obviously, don't cover up what the patient just wrote. And then the tube with the labels on it goes in the biohazard bag. Those bags actually have 2 compartments. The sample itself goes in the Ziploc portion. So put it in there, seal it up. If there is any paperwork, if you made photocopies or something like that of their health insurance cards, there's a sleeve or a pocket on the outside of the bag. Just fold up any paperwork and slide that in there. We just don't want that, if at all possible, being included in the Ziploc portion of the sample or of the bag, because then we have to treat that piece of paper as if it's contaminated. And that just causes some extra steps on our end. But just seal the bag, put any paperwork, if there is any, in the outer sleeve, throw it in the UPS box, and you're good to go. As far as that duplicate QR code label that you currently have with your collection kits, that can be put on any of the pieces of the paper. It can be put on the outside of the bag. It can be stuck to the patient's forehead. It doesn't matter to us. It just can't go on another patient's sample. We can navigate that when it happens, but if we can avoid it, that's obviously best. And that's it.
Okay, I think we're good. April, do you have questions?
The only question that I had was for payment. We received a check in the mail the other day. It said Mobility Health on the upper left-hand corner. So I had asked one of the girls, do you know how we get paid? And I believe that will be the process, correct? That we get in the mail?
Yes. Well, it's up to you. So on a monthly basis, so usually like the second week of the month. So this was probably like 2 weeks ago, I imagine, or last week that you got this. Here, I'll game it out for next month. On or about February 15th, we're going to send you a report that says for the month of March, we received 20 samples from you. We owe you $400. Typically what she will do, our controller will do, is ask you if you want a check or if you want to set up a direct deposit. If she doesn't ask you for it and you would rather just do a direct deposit, just respond to the email and say, can we set that up, or reach out to me and I'll get it set up for you. But if you want checks, that's fine. She'll kind of let you know what the amount is, and then you'll get the check in the next couple of days, or you'll get the direct deposit, that day or the next day. And then if you see discrepancies, we'll deal with them. We used to ask you to verify the numbers before we cut the check, and learned that, of course, you get 1,000 emails a day. If you happen to miss that one, we don't want you not getting paid because we're waiting for a response. So we pay you what we believe we owe you. If you see discrepancies, we kind of work those out after the fact. But the information is based on exactly what you can see in your portal here. You can sort this by date, and you can see, for the month of whatever, there's this many samples that are completed. We pay based on completed orders. So if something gets rejected for some reason, we don't pay for those. The most common reason that a sample gets rejected is, believe it or not, there's too much sample on the swab. So like with pediatricians, we tell those crusty, boogery little kids to have them blow their noses first. We can get around it if something happens. So if it says rejected, it just means that that particular specimen from that sample has been rejected. We will always try to rerun it. We will run them up to 3 times before we would just outright reject it and contact you and or the patient and ask for another sample to be collected. That happens far less than 1% of the time. There's some things we can do to manipulate samples. You know, we have like an automated way that we draw samples out of these collection tubes when we receive them. We can go to a manual method where we make sure we don't essentially pull up that, you know, whatever it was that was causing interference. For a sample to be completely outright rejected after those 3 tries, I can almost say without fail, it's because the patient either purposefully or inadvertently did not collect their sample. And we ran into this, you know, in previous years when people were required to have negative tests in order to travel. They thought they could beat the system by just turning in a blank swab, and it doesn't work that way. If there's no DNA on there, it doesn't say negative, it says invalid. And so it's pretty easy for us to tell when that happens. Since that requirement has gone away largely around international travel, we don't tend to see that too much. So, but anyway, the payment is based on successfully completed samples, which you'll have access to through your portal at all times to kind of compare our results to yours. But all we're doing is downloading that exact info to determine what your payment is.
That sounds good. I don't know, Charlotte, what you think. I'm assuming it might be nice to have automatic deposit so that we have that.
Yeah,
Okay.
I agree. Yeah.
If that's what you want, then I'll just go ahead now and I will reach out to our controller. Her name is Stephanie. She will send you guys an email. All she's going to ask you is either to fill out the form that she sends you, or you can just send an image of a voided check, and that's going to have the info we need. And then she'll set that up in the system, and that's how it'll be from this point forward.
That sounds good.
Okay, cool. All right. Yeah, we ran a little longer than I wanted to. I apologize for that. If there are other questions now, fire away. If not, and you think of them later, again, in my email signature is my cell phone. It's always, you can email me anytime, but cell phone's a great way to get a hold of me. And like I said, I'm pretty good at getting back to folks immediately, especially if it's through a text. So feel free to hit me up however you want.
Okay, sounds good.
And then
Sounds
again,
good.
if you run into that same thing with that missing mystery button, let me know right away, because I'm so flabbergasted about that one that I want to figure out what that was all about.
Okay.
All right.
And if you could send us a email with the recording, that would be great.
Yep, you got it. Yep, I'll post that right
Thank you
now
very
and
much.
shoot you the link. Awesome. Okay, guys.
Okay. Thank you
Thank
for
you
your
so
time.
much. You too.
Thank you.
Yep. Bye-bye.
Okay.
Bye.